Welcome to today's video on OET overview and tips. What is OET? OET stands for Occupational English Test. This can be taken as a paper-based test or computer-based. There are 4 parts to it: listening, reading, writing, and speaking. Now let's come to the reading part. It has 3 parts. In part A, you'll get 15 minutes for 20 questions, and in part B and part C you'll get total 45 minutes for answering 22 questions. In reading part A, there is a 15 minutes time frame in part A. They'll take the answer sheet away after 15 minutes. So time management is very crucial in part A. Try to keep your answer sheet in front of the question paper so that you can answer right away. What you have to do in part A, you have to skim through the text boxes for headings and main context within the first 30 seconds. Then scan for the exact information for question number 1 to 7, which are text box matching questions. And then scan for the exact word or phrases for question number 8 to 20. In part B, there will be 6 questions. Read the whole paragraph first to get an overall idea. Then compare the options with the information given at the paragraph. Don't look at the options first or you may get confused. Spend almost 2 minutes on each question. If you feel stuck, move on to the next question, answering the tentative answer, because you will not be given negative marks for the wrong answer. You can keep a secret mark like dot or question mark for later review if you feel confused about the answer. Now let's come to the reading part C. You have to look at the questions first. Question number 7 to 22. Look for a keyword. Now read the paragraph to find the keyword. Read around the keyword to get a holistic idea. Read and understand and then compare the options. Some options may contradict, some may not be mentioned at all. Believe in your intuition. Spend almost 2 minutes on each questions. And if you feel stuck, move on to the next question, answering the tentative answer. OET listening consists of 3 parts. In part A, there are 24 questions. In part B, 6 questions, and in part C, only 12 questions. Listening part A, question number 1 to 24. You will get 30 seconds to look at 12 questions, then answer while listening. Be attentive from the start. Adjust to high volume. Be careful with the transition of topics by keeping in mind the next line or question. Be very attentive to the keyword in the question. Normally, the audio follows the text sequentially. Don't erase the wrong answer while listening, rather cross out with a single line. Because if you try writing after erasing, then you may get lost in the audio. Be very attentive to the articles, singular or plural forms. Better to avoid abbreviations while answering. Listening part B, question number 25 to 30. Different contexts, separate audios for each context will be played. Pay high attention to the keyword in the question. Build mental map of the options in 15 minutes preparation time. While listening, search for the keyword or synonyms in the audio. Then rule out the other options. In listening part C, question number 31 to 42, it is divided into 2 parts. You will get 90 seconds each to look at each 6 questions. Look at the questions with options. Try to make a mental map. Then second time, look at the questions only for keywords if you have enough time left. Then when the audio is played, try to rule out the options while listening and scanning at the same time. Figure out the answer with the help of the keywords. While listening to the audio, beware of transition to the next question. In speaking, there will be 2 role play cards subsequently. You will get 3 minutes preparation time. In each card, you will have to speak for 5 minutes to complete the tasks. So how to start the speaking? You can start with greetings and introduction of yourself. Then confirm patient's name and age. in case of new patient. Then ask what brings the patient here today. Show empathy and ask more in details. Try to elaborate the symptoms. Tell the diagnosis and explain in details. Tell the management and reassure the patient. Deal with reluctant patient and check for their understanding. And at last, summarization and ending. This picture showing when to wish a good afternoon and when to wish good evening. Now greetings and introduction. You can greet the interlocutor or the patient good morning, good evening or good afternoon according to the time. Now introduce yourself by saying I am Dr. X. I'll be your attending doctor today. May I confirm your name and age please? Please remember these are not to be mentioned in follow-up visits. Then you say nice to meet you Mr. X. What brings you here today? Or how may I help you? When the patient ends explaining his condition, then empathize by saying, I am so sorry to hear that. Can you describe a little more? Would you mind telling me more about it? You can elaborate the symptoms by asking, when did you first notice this? Can you tell me where it is? What makes it better? What makes it worse? Have you taken any medication for it? Is there anything else bothering you? Now that symptoms have been elaborated, let's come to the diagnosis. You can start by saying, well, based on your symptoms and after examination, I believe what you have is called this condition. Or the test results show that it's probably a condition known as this. Do you know anything about it? Sometimes the patient may already know the condition or the disease from one of his or her relatives or peers, or have a misconception about the disease. Then you have to explain by saying, let me explain. It's a condition caused by this due to this. Now let's come to the management part. You can indicate the transition of the topics by saying, now that we have discussed about the condition, let's talk about the treatment. First of all, I think we should start with this drugs or this therapy. If you want to refer the patient to a specialist, you can say, I'll write a referral letter to a specialist. There are very effective strategies to cope with. I would like to explain them to you. Is that okay? I see that must be a very difficult situation for you, but the good news is there are several options available which will help you. Would you like to hear more about it? Or it's a good time to start. In terms of your disease, it will be necessary for you to follow this. Sometimes after you have talked about the condition, patient may become emotionally labile. Then you have to reassure the patient by saying, I know it sounds difficult, but let me assure you that if you follow my advice, you will get much better soon. Rest assured, this is quite a common condition, nothing to be alarmed about. If the condition is self-limiting, you can assure the patient by saying, let me assure you that it is self-limiting. Don't worry, it will go away by itself in a few days with some rest. In case of reluctant patient, you can manage the patient by saying, I can understand your reluctance or your concern or your worries or stress. I can understand it can be challenging or stressful or daunting. But let me assure you, if you follow my advice, you'll be okay. But you need to follow it properly. Now, in the ending, try to check the conception of the patient, whether he has received the right message or not, by saying, is that clear? Am I clear so far? Do you think you can do that? I recommend or strongly advise that you should lose weight, quit smoking, or reduce alcohol intake. Do you have any more questions? If the patient says no and you have enough time left, then try to summarize the conversation by saying, you have come with this condition. I have explained the condition and told you about the possible management options, and you'll be possibly doing this, and this. At last, I would like to see you in a week. Don't hesitate to contact me if you have any concern. In case of some special situations, you'll have to give some special counseling. For example, if the patient is diagnosed with cancer, then you have to say, then you can say, we have the test results back, and I'm sorry to tell you that the cause of your symptoms could be more serious than you think. Guys, that this may come as a shock to you, but it's really important that we do further investigations including this. Unfortunately, we caught it early, and there are some treatment options available. Or unfortunately, we caught it late. In case of referral, you can mention the cause of the referral and whom you are referring to by saying, now regarding your diet, I can refer you to a dietitian. Or regarding your speedy recovery, I can refer you to a physiotherapist. You can attend our weekly training program as well. Writing is a huge task in OET. There are hundreds of ways you can write your letter, but make sure to give proper attention towards grammar and sentence structure. Write the information from your case notes subsequently like a story. I will try to give a basic idea about writing. There are three types of letter. If a letter is written by hospital authority to a caregiver, it's a discharge letter. If it's written to another facility, then it's a transfer letter. Or if it's written from one caregiver to another caregiver, then it's a referral letter. But please remember, in case of discharge letter, if it is written to a old doctor or local doctor or primary care physician, then no need to write personal history. Now let's come to the discharge letter. Start by addressing, then introduction, admission status, hospitalization information, discharge day status, personal history, conclusion, and closing. In addressing, write the doctor's name, then designation, facility name, address of the hospital, and then write today's date and address the doctor as Dear Doctor and write the last name of the doctor. Then write patient's name and his date of birth or age. Always use capital letter in each word and don't use comma in the address. You can start the introduction by I am writing to update you regarding or inform you regarding, not about. Mrs. Lucy, write the surname of the patient, an 80-year-old lady, don't use year short form, who has been discharged today after successful recovery from enteric fever. Your further follow-up care, including CBC, would be highly appreciated. I am writing in regards to Mr. X, who has been discharged today after being diagnosed with, write the disease name. Your further follow-up care would be highly appreciated. Now regarding the admission status, you can start as, initially on this date, Mr. X was admitted with the complaints of, write the complaints. She was commenced on, write the drug names. Her physical examination was unremarkable apart from, write the positive findings. Or you can write as, her physical examination revealed that, write the positive findings. Therefore, a set of investigations was ordered. Subsequently, she was commenced on, write the drug names, or you can write the drug names first, then write was prescribed or were prescribed. Her investigation reports showed elevated level of, write the elevated level of the findings or decreased level of. All the investigation reports were unremarkable except, write the positive findings. Regarding hospitalization status, you can write as, during hospitalization, her condition had improved or worsened or new symptoms had developed. And today, the discharge day, she presented with this condition. Medications were advised or added or changed. Write about any other advice or mention if any review was scheduled. You can write it in either past form or in present perfect tense, but please make sure to follow the tense throughout the paragraph. Regarding the personal history, write whether the patient is a smoker or alcohol drinker or not. Regarding her medical history or in terms of her medical history, in case of chronic disease, use present tense like she has diabetes mellitus or hypertension. In case of acute cases, use past tense like she underwent appendectomy or had a history of pneumonia. Her current medications include, write the medication's name. Please note she is allergic to, write the allergen. Her family history is notable for, or she has a positive family history of, write the positive family history. Conclusion. Based on the above, it would be greatly or highly appreciated if you could monitor Mr. X's condition and repeat these investigations. Your expert assessment and management will definitely benefit Mr. X's speedy recovery. All relevant documents are enclosed along with this letter for your perusal. Then write, should there be any queries, please do not hesitate to contact us. And in closing, you write, yours sincerely or with regards in case of nurse or physiotherapist, then doctor's name. Last but not the least, never write or quote the exact sentence from the case notes. Rather, try to paraphrase the case notes or use synonyms in case of words. Use linkers whenever possible, but don't overuse them. Use maximum 2 to 3 linkers in each paragraph. Try to write in complex or compound sentences. Overall, tell a story. Check for spelling mistakes and capitalizations. Some useful linkers are given below. Thank you all for your patience. Please like and subscribe our channel if it was helpful because it will encourage us to make more videos like this.